This is the first video about a paper I helped to write, titled COVID-19 Proposing a Ketone-Based Metabolic Therapy as Treatment to Blunt the Cytokine Storm. The videos fill in some of the background left out of the paper and explains it in simple terms. I want to introduce myself and the other co-authors and say a little bit about how we got the idea for this paper and where this talk is going. I will start by telling you about myself. My name is Bill Curtis. I've had Parkinson's for 20 years. I worked with the late Dr. Richard Veach on raising my ketone levels through exercise, fasting, and diet. Parkinson's is measured by the Universal Parkinson's Disease Rating Scale. My UPDRS score improved from 50 to 9 or 10. So I have personal experience using ketones to fix a complex neurological problem, and I know something about what makes them work and what interferes to make them stop working. The first author is Patrick Bradshaw. We pored over about 700 references and used the understanding of bioenergetics we had learned from Dr. Veach. Along the way, we picked up 3 other authors. One was the researcher from AFRI, Dr. Alexandra Miller. Her lab did the radiation study in mice that made us think ketosis might work in COVID-19. Vikrant Majahan has done lab work under Dr. Veach and Dr. Lovinger studying ketone ester mechanisms using a mouse model of Parkinson's. And finally, Dr. William Seeds provided the perspective of a medical doctor with extensive knowledge of cytokines. So where did the idea for this paper come from? Dr. Veach predicted radiation could be overcome by exogenous ketones. This work was undertaken by collaborators at the Armed Forces Radiobiology Radiation Institute, where Dr. Miller's group found that exogenous ketones could preserve greater than 95% of the mice exposed to an LD-70 dose of radiation, which is 8.5 grays. There were similarities between COVID-19 and the radiation damage. Both result in a cytokine storm. The storm is caused by the innate immune response to the patterns of broken down biomolecules produced by hydroxyl radicals. The innate immune response causes a feedback loop that spirals out of control. The ketone ester developed by Kieran Clark and Richard Veach was able to interrupt this feedback loop and restore or normalize the levels of cytokines in radiation. This led us to think, if exogenous ketones work so well in protecting from ionizing radiation, could they also work for COVID-19? In ionizing radiation, C-reactive protein, or CRP, is a prognosticator of the severity of the response to radiation. The ketone ester cleared up sequelae due to radiation such as chromosome damage and restored CRP levels to normal. CRP is produced in the liver in response to interleukin-6. In COVID-19, the C-reactive protein, CRP, is a widely available and inexpensive test that is an excellent predictor of risk of severe symptoms and a predictor of the likelihood of progressing to acute respiratory distress syndrome. This leads me to ask if it would be possible to have a clinical trial. The patients who received a positive test for COVID-19 could return for a test of CRP levels in the blood. Those with an elevated value could receive a 3-day or 14-day course of oral ketone ester. This may be sufficient to reverse the trend towards ARDS. What you will see next is a person who had COVID-19 and her breathing and symptoms cleared up within minutes of taking the ketone ester.
I get winded real easy. I was in because I was having problems breathing. And they had me there pretty much all day, and then they sent me home. Yeah, and the wheezing, the trying to breathe is a lot different from before I drank it and then after. Just a small time, I can already see a difference. When we first started this, I was burning up and sweating really bad, and now I'm not. I'm talking a lot now.
So, that is who we are and what caused us to write the review. I want to say something about where future videos in this series are going. I intend to walk you through the graphics in the paper starting from Figure 1. From Figure 1 and 2, I made a table. The first column shows the steps in the cascade of the SARS-CoV-2 infection leading to ARDS. The second column lists the ketone esters response. The third lists the evidence we have for ketone esters response. I will be covering all these in future videos. Thanks for watching.